Hello and welcome to this COVID-19 mortality briefing. My name is Tony Roberts. I'm Deputy Director at the North East Quality Observatory Service. This COVID-19 mortality briefing is designed to supplement the normal NEQOS quarterly reports that we produce for trusts across the region looking at hospital mortality. Most people realise that there have been more cases of COVID-19 and more deaths in our region than for most of the UK, and people would love to know why. Unfortunately, I'm not really going to be able to answer that question today. That's going to take detailed research work, looking at the play of risk factors as they occur across the UK and how they might be different in the North East. All I can really do today is just describe the situation as we see it, what the counts of deaths are and how they turn into rates. And that's going to be an unadjusted look. It's not possible to do a more sophisticated analysis yet. So there are three sources of data for COVID-19, the most important of which is CPNS, the COVID-19 Patient Notification System, used by hospitals to report deaths from COVID-19 in the hospital setting. There's also the data produced by the Office for National Statistics, which reports on death registration. So that's deaths reported anywhere in any setting. So we can look at all cause and COVID-19 mortality using that data. The CQC have also produced data around deaths in care homes, but I'm not going to cover that today. Where we've tried to convert data to a rate, we've used relevant populations to do that. Okay, so let's have a look at the map on the right hand side of the UK. You can see that the darker colours are high numbers of cases. Actually, this graph is publicly available in all sorts of places, this map. I've taken the BBC version of it, which reports the number of cases per 10,000 people. And you can see that the North East and Cumbria in all cases has at least 30 cases per 10,000 people, and the darker colour in Middlesbrough and in Cumbria 40 or more cases per 10,000 people. And that is more than most of the rest of the UK. If we now look at the graph on the top left, we've got counts in white inside the bars, and you can see the England bar at the top in black, and that all the bars for local authorities in the North East are longer than that. So we've got more cases per 100,000 population. There are four which seem to have more cases per 100,000 population. So Gateshead, Middlesbrough, South Tyneside and Sunderland, with the rest looking more similar to each other. If we look at the bottom left graph now, the counts of deaths reported by hospitals to CPNS is the red figure inside the bar. But in order to try and get a feel for roughly how much that is compared to the size of the population served by the trust, a rate's been calculated using the Public Health England Trust catchment populations. Now this is a pretty rough and ready way of doing it. The trust population served, it comes from a pre-COVID period, so is what the trust normally serves. And obviously that's changed during COVID-19, but it gives you a rough feel for the number of deaths compared to the size of the population served. And again, you can see there are a couple that stick out, so South Tyneside and Sunderland and Gateshead with the highest rates. Other trusts looking roughly similar, with the exception of Newcastle, who appear to have had the lowest rate. This is the shape of the outbreak in England. So this is the number of deaths reported daily. So you can see the rapid rise to a peak in April, and then the decline in the numbers, and we've reached a stage by the end of May where the rate of decline has reduced, so that 7-day rolling average in red is getting flatter. So the epidemic hasn't gone away, and we're looking at something a little below 100 deaths a day at this stage of the outbreak. You can see the same sort of peak in the death certificate data produced by ONS. So the blue line is all deaths, so all cause mortality in all settings, and the dotted grey line is the number that you would expect based on a 5-year average, and you can see what an extraordinary peak we've experienced. The red line shows how many of those deaths involved COVID-19, shown against the influenza and pneumonia 5-year average. So it's been a lot more severe than any normal influenza or pneumonia outbreak. Another way of showing that is produced by Public Health England. This is the surveillance data normally used for looking at seasonal outbreaks of flu and pneumonia. So if you look at 2017-18 in the middle, you can see we thought we had a pretty bad winter that year. So the black line showing the actual against the blue, which is the 5-year average. But if you look at the spike for COVID on the right hand side, you can see how extraordinary a period it's been and how much the death we've seen as a result. We can see the ONS way of showing this excess mortality in weeks against the 5-year average, and the peak coming around week 16 or 17. And you can see that a lot of that is COVID related in the lower of the two graphs. So the red part of the bar is COVID-19 mentioned on the death certificate, and there is a bit of mortality which is excess, which isn't clearly COVID-19 related. We don't really know whether that's to do with deaths that were COVID-19 related but not recognised as such, or whether it's from other causes and why that might be. The pattern for England is replicated for the North East. So the scales are different, but the pattern hopefully is apparent, and we can see again that there have been both COVID and non-COVID excess mortality compared to the 5-year average. Just to give you a feel for the scale of that, this takes just the data for the week at the end of May, 23rd to the 29th of May. So instead of 438 deaths, which would be our 5-year average for the North East, we actually saw 550 deaths, and that's an increase of about 25%. You can see how big the comparison is in other parts of the country. So in London, which was earlier in the outbreak, that rate has gone right down, about 8%. And then you can see the variation across the hospitals. We're not the highest, but still 25% greater. So where are those deaths? So England on the left for care homes and hospitals, North East on the right. And again, you can see that excess mortality has been really important in care homes, and lots of excess mortality which is not clearly COVID related. Again, it could be to do with not being able to recognise it. It's difficult to know if a patient has died from COVID in care homes, particularly early on when testing was less. And then you can also see that there's the excess mortality in hospitals. There is a big peak, COVID related, but you can see it towards the end, the 3 or 4 bars at the end, we've got down to average or below average mortality compared to the 5-year average. This is the shape of the outbreak again for England and Wales. Purple is hospitals and green is care homes. So you can see what a big chunk of deaths are accounted for by care homes. And in May it's something in the order of 40%. The peak is also slightly later in the care home setting. So just to summarise, hospital deaths in England peaked on the 8th of April and in care homes on the 17th of April, so slightly afterwards. COVID-19's had a big impact on weekly death registrations, and April is much higher than normal for England. There's still quite a lot of excess mortality in May, something like 25%, for the last week of May compared to the 5-year average. And the proportion of deaths in care homes is really substantial, and it's about 40% in May. June, the excess mortality is expected to keep coming down, and as the numbers of cases reduce, the excess mortality should also reduce. Finally, just to touch on a couple of remaining topics. So there is a more sophisticated time to outcome analysis being performed by NEQOS on behalf of the trusts across the region. Most trusts have been able to return data. There's a bit of cleaning work going on at the moment, but that'll be available shortly. There's also a more sophisticated version of the analysis which will take into account risk factors, being done by Durham University through the Trusted Research environment. And if you need more information about that, please drop me an email. And then finally, I just want to touch on risk adjusted mortality, which, as you know, is normally reported through the summary hospital level mortality indicator, or SHMI. It takes a while to come out, so I'm just going to describe when we're going to see those reports. So we are due a NEQOS report at the end of June. That will only cover SHMI data up to the end of 2019, so December 19, so pre-outbreak. We'll then see in September data to the end of March 2020, so the beginning of the outbreak included. It's likely that NHS Digital will exclude patients with COVID from SHMI because SHMI was not designed for pandemic periods. Whether the SHMI will work without those patients in or not, it's very hard to tell at the moment, but we'll describe that in that report, or at least begin to. But as we've talked about, the outbreak was at its peak in April, and so we won't really be able to see the data until the next report, which takes data to the end of June 2020, and that won't be available till December. So we've got quite a long way to go before we know what risk adjusted mortality indicators like SHMI look like. Okay, thank you very much for listening, and I hope this brief presentation has been helpful.